Hello, welcome to Healthy Eyes Hub. In today's video, we will continue with the cornea. We will explain the common conditions of the cornea and how they are managed in the clinical setting. Please like, share this channel, tell us what you want to know about the eyes in the comments below, and subscribe if you haven't already. First is keratitis. Keratitis refers to inflammation of the cornea. Inflammation is not a disease or condition on its own, but it is the result of an underlying disease process. It often results from a minor injury, improper use of contact lenses, infection, and so on. Antimicrobial drops may be used to treat the etiological agent or prevent worsening of symptoms, and steroid eye drops may be of benefit in reducing the inflammation in some cases. Second is allergy. The majority of allergies affecting the eye are related to pollen dust or pest dander exposure. Signs and symptoms may include itchiness, redness, stinging or burning, tearing, and excessive watery discharge. These symptoms are often relieved by the administration of eye drops containing antihistamine or mast cell stabilizers. Multi-action eye drops are also available in treating corneal allergies. Third, dry eye results from a lack of quality tear production, often described as a scratchy feeling, as if there is a foreign object sensation in the eye. Fourth, injuries to the cornea vary widely in severity. Minor scratches typically resolve spontaneously, whereas deep corneal abrasions may result in scarring, which may cause blurry vision, sensitivity to light, or pain. The fifth is corneal foreign body. A foreign object present in the cornea, one of the most common preventable occupational hazards. This may be removed under topical anesthesia using the slit lamp and foreign body removing forceps. The sixth one is corneal abrasion. It is a medical condition involving the loss of the surface epithelial layer of the eye's cornea as a result of either mechanical or chemical trauma to the surface of the eye. It is usually treated with anti-infective drops and or lubricants. Next, keratoconus is a relatively common dystrophy, estimated to affect approximately 1 in every 2,000 persons. Keratoconus involves a thinning and cone-shaped bulging of the cornea, which disrupts the normal transmission and refraction of light. Keratoconus is most commonly diagnosed in teenagers and young adults. Corrective measures include the use of corrective lenses and, in some cases, the implantation of intracorneal inserts called inserts. In severe cases, corneal transplantation could be necessary to preserve vision. In addition, corneal cross-linking can be done to correct keratoconus. Corneal cross-linking involves the administration of riboflavin to the surface of the eye, followed by treatment with ultraviolet light to eliminate ectasia of the cornea. The FDA first approved the use of corneal cross-linking systems in the treatment of keratoconus in April 2016. Less commonly, corneal dystrophies may compromise corneal health. Corneal dystrophies involve opacification or modified shaping of one or more several layers. They affect both eyes, have a genetic component, and progress gradually. Several types of dystrophies exist. Lattice corneal dystrophy involves amyloid deposition in the corneal stroma and follows an autosomal dominant inheritance pattern. It is divided into two primary types. In type 1, amyloid deposition is limited to the cornea, while type 2 exhibits systemic amyloid effects. As the condition progresses, patients experience recurrent corneal erosions and corneal opacification. Treatments aim to address these primary symptoms and may include the use of hypertonic saline eye drops, bandage contact lenses, artificial tears, laser surface ablation, and corneal transplantation. Fuchs dystrophy, on the other hand, is a malady in which the corneal endothelial cells die. This condition impairs their ability to pump fluid out of the stroma, which results in fluid buildup in the cornea and subsequent visual impairment. In the first stage of the disease, vision is hazy in the morning but improves improves as the day progresses, while in stage 2, vision becomes impaired throughout the day. Treatment typically aims to reduce corneal swelling, which could involve the use of hypertonic saline eye drops or a hairdryer to dry the cornea. Many cases may require corneal transplantation. Another is map-dot-fingerprint dystrophy or Cogan's dystrophy. It results from the abnormal development of the basement membrane of the corneal epithelium. It is most commonly present in patients between the ages of 40 and 70 years. Patients exhibit grayish outlines in the cornea on a slit lamp examination. The instability of the basement membrane can cause chronic epithelial erosions, which may lead to blurred vision and/or painful episodes due to the exposure of nerve endings lining the epithelium. Most cases receive treatment with lubricating eye drops. In some patients, anterior corneal stromal punctures, corneal scraping, and phototherapeutic keratectomy may be options. Also is iridocorneal endothelium syndrome. This condition causes glaucoma, visible changes in the iris, and swelling of the cornea due to the movement of corneal epithelial cells to the iris. In iridocorneal endothelium syndrome, that is ICE, treatment of glaucoma is often requisite, and in cases of severe corneal compromise, transplantation may be necessary. Pterygium or pterygia are triangular pinkish growths on the cornea that are more prevalent in sunny climates. Surgical removal is only a recommendation in cases where vision is impaired, and the recurrence rate is approximately 50%. Infection may affect the cornea. Infectious agents that affect the cornea with relative frequency include varicella zoster, that is shingles virus, and herpes simplex viruses. Herpes zoster ophthalmicus is a varicella zoster reactivation, that is shingles, involving the V1 dermatome. Antiviral treatments may be of benefit for herpes zoster ophthalmicus since herpes virus infections can cause corneal damage, impairing vision. Another condition is corneal ulcer. Corneal ulcer is an inflammatory or infective condition of the eye involving disruption of its epithelial layer with involvement of the corneal stroma. Finally, corneal neovascularization is the excessive ingrowth of blood vessels from the limbal vascular plexus into the cornea, caused by deprivation of oxygen from the air. All of these conditions of the cornea can be managed if early diagnosis is made. It is important to report to the hospital in order to receive benefits from treatment outcomes promptly. In our next video, we will learn about how to care for the cornea. Please leave a comment below about what other thing you would like to know about the eyes. You may check out our video on the anatomy of the cornea to appreciate well the layers of the cornea. Thank you for learning with us.